This is KLEAN Radio.
Welcome everybody out there listening to KLEAN Radio on our flagship station, 790 KABC. Not a better station we could ask to be on.
That's right, and Sirius XM.
Or Sirius XM 243, somewhere in the middle of the XM dial. And also KLEANradio.com, that's clean with a K. You could go there right now and look at what Andrew and I actually look like.
If you choose to.
Please don't, yeah. Just imagine us to be the greatest looking people in the world, and just go with that. But if you are curious, go to KLEANradio.com. We have a good show tonight. We had a great show last week, Andrew. We had tons of callers. One of the things we asked is, what is an alcoholic?
Yep.
And
it's too bad we didn't actually get to everybody.
We had tons of callers that we couldn't get to. So if you couldn't get in last week, or you want to ask tonight, or you want to talk about that tonight, give us a call. The number here is 800-222-5222. That's 800-222-5222. There's a lot going on in the news. Sadly, there's an actor that died, I think yesterday, Corey Monteith, from the television show Glee. Andrew passed away, 31 years old.
In his hotel room.
And in his hotel room in Vancouver, Canada. And, he had been in treatment probably about a month ago. And, it's really sad. I mean, he was the all-Canadian boy or all-American boy. He just looked like that. And I saw a lot
of... they're not going to have the autopsy until Monday, right?
So they're not going to have the autopsy.
We don't really know for sure.
We're not going to speculate, but...
Right. Odds are he probably relapsed.
Right.
Yeah.
And one of the things I posted on Facebook today, and I really want to touch upon this tonight, we've talked about this before. My father used to say, as long as you're alive, there's a chance. Mm-hmm. And sadly, there's no chance for him anymore, but there's a chance for people out there that are going through it right now, that if you're listening and you're in that struggle of addiction or mental health or depression, you're alive and there's a chance.
That's right. Yeah, I mean, it's amazing, 30 years old. People are realizing now that these drugs and what's going on, not only do they have a direct effect when you take them, but sometimes also the health effects later on can get you as well. So, it's something to take care of.
I mean, the sober fact of the day is the World Health Organization estimates that approximately 2 million people in the United States alone are addicted to prescription opiates.
Yeah, it's 2 out of 100, right? 1 in 50.
That is a lot. And, so if you're out there, also, we love hearing the stories. So I would love to hear stories from people tonight about how you overcame it, to help the people out that are going through it too, because, we need to hear those stories because they need to know that there's hope.
Yeah. It's really incredible. You put on top of this the mental health issues. You have 2 million people with schizophrenia. There's some crossover there. And then you've got 50% of the population or more that's going to suffer major depression or major anxiety event in their life. And a lot of those people cross over into addiction as well. So it's something that touches most people, and if not directly, at least someone in their family. And we talk a lot about that on the show as well, as family members and how they can get help for a loved one or a friend.
Yeah. I mean, it's one of those, we were talking a little bit about Corey Monteith, the actor from Glee, and I remember reading the story that he went to rehab. And and it was probably a 30-day, 50, whatever it was, 28 days. And I remember thinking, it's not over. If you don't continually take care of yourself once you get out of rehab, you're not really dealing fully. And I'm not speaking because I know nothing about him or what he was going through, but this is, constantly people think, oh, you go to rehab and you're better.
Yeah, well, I mean, a month out is not very far out, right?
Right.
So,
and it's very, nobody goes to the hospital for, a massive coronary or, they've had, valve, whatever, done. And then that's it. They go back to eating a steak. You have to take care of yourself. And it's the same thing with addiction.
Yeah, well, addicts, I think, without the proper supervision afterwards, are likely to do that. I mean, you hear about that all the time. People that will overdose and then they'll immediately go back out and take the same drug again. Even rehab, just a month of rehab is not enough. It's just the beginning. And it's really important. One of the worst places you can go after rehab is a hotel room. It's just you're sitting there with a mini bar.
Right. And alone
nothing to do.
And isolated.
And totally private.
Yeah.
I mean, you can do anything you want. And that's why a lot of drug addicts use, flop houses and hotel rooms and stuff like that to escape from family and friends. and they hole up and they just use because they're isolated and depressed. And
it's a safe place for an addict.
Yeah, ironically, it's a dangerous place as well. But yeah, it's a safe. They feel like it's a safe place.
Right? It's a safe place. I'm not saying it's actually one of the most dangerous places. But that's one of the things, I'm not. I'll give kudos to KLEAN because that's one of the things that we really try to deal with there at KLEAN is the continuum of care. That once you come to us, you're with us. It's like the mob. We want to follow. We want to follow you forever because we care about you.
That's right.
And we don't just believe that it's a 30-day process, 60-day process. This is a life, and this isn't something people want to hear all the time. As you're going through it, or your family is going through it, you want to hear the quick fix.
Well, a lot of people fall for that idea that there's a cure for addiction, and it's been pretty much proven scientifically that there's not. For a long time, there was an anti-disease model movement. A guy called Stanton Peele actually wrote a book called The Diseasing of America. And he wrote a lot about how addiction was a myth.
Right.
And that there was no such thing as a physical disease of addiction. And it was just part of this trend of self-help and in the 80s, and Americans wanting to believe that, everything's a disease and a problem and they can just fix themselves. We found out now, of course, that there's a lot of scientific information that shows clearly that addiction has biophysical attributes and is clearly some sort of at least malfunction, if not outright disease.
And it makes no sense when you think about it. By the way, if you just tuned in, you are listening to KLEAN Radio. To give us a call, the number is 800-222-5222. That's 800-222-5222. One of the things we want to talk about tonight is if you're struggling or if you're in pain, give us a call, share about it, but also if you've recovered from that pain, give us a call because we want to hear about that.
I want to hear from some family members. We had a great family weekend this weekend.
Yeah, we had an amazing family weekend at KLEAN, and it's absolutely amazing watching, the change that happens. I was walking. I take some of the clients sometimes to 12-step meetings, and I bumped into one of the clients with his mother, and we have a lot in common. The school we went to, me and this client, and we were joking, and I said, we went to, I go, there's hope. I'm him 15 years later. I'm the same kid that was in that same school. And it was watching, she smiled. And she goes, thank you for sharing that because sometimes you don't always get to see that.
Right. Yeah. Yeah. It's great.
And so we want to hear from you tonight. It's really sad. I mean, it's, this, what you were just talking about, this thing about alcoholism, drug addiction, not being a disease. What more do people need to prove? You see somebody like Corey Monteith, 31 years old, has it all, and people are not willing to say, take him aside, but people aren't willing to look at people that are in their 30s that are committing suicide. By using heroin, you're committing slow suicide. By using opiates, it's slow suicide. And nobody's willing to say, Yeah,
I mean, this is where with academics or whatever, I'd love to have a debate of whether or not it's a disease. But when you get down to just speaking to people every day, it doesn't really matter whether it's a disease or not. The problem is that it's, a compulsive disorder that will end up in some sort of serious problem. You're headed towards chronic illness, maybe not directly from the drug you're taking, but indirectly. The classic being cirrhosis of the liver with alcohol, but all these other pills and everything that people are taking have huge effects on the body, and everything you do to yourself sort of makes an effect.
Right.
So it doesn't go away. Even if you stop, you still have to work on recovering and getting healthier. So.
And the thing is, it's with addiction, with it being a disease and other diseases, nobody says to the guy with a heart attack, guy has a massive coronary. Nobody says, get back to work right away. Get back to work. Get back to work.
The guy with the heart attack might say that.
But everybody's like,
if he's a workaholic.
But everybody's like, but when it comes to addiction, it's like, when's this fix going to happen? When's the fix going to happen? And it's this instant, like we were, this is your life. Using drugs could kill you instantly, and unless you deal with it like it's every other disease, the odds of a cure.
Yeah, I mean, it's most like diabetes. I mean, it's sort of a chronic, long-term problem, and if you don't manage it and work on it, then there's serious side effects, including death.
Let's go to Josh in New York. Josh, welcome to KLEAN Radio.
How you guys doing?
Good. How are you?
Oh, I'm all right. I'm giving you guys a call because I've been struggling with an issue with opiates.
Right.
Okay.
I've gotten clean using Suboxone. I've never quite gotten off of the Suboxone, though, which is a whole nother dragon. But I was wondering if there was any other prescriptions out there other than Suboxone.
There's various different formulations of Subutex and Suboxone. And then, of course, there's methadone, which is what was replaced largely by Suboxone. How many milligrams are you on right now?
I mean, I was supposed to take 2 8 milligram tablets, the ones that dissolve, the strips.
Yeah, the new ones.
Honestly,
Yeah.
I never did that. It just was pointless. I always cut them directly in half. I mean, I've been down to taking only an eighth a day, and like I said, then I'll start mixing between. I even chose a job that drug tested me, and I just can't seem to stop doing it.
Yeah, I mean, that's interesting, too, because you're not using sort of in a regular pattern. You're using sporadically.
Honestly, it seems like as I do better, and I'll start having a decent bank account and stuff like that, that's when I go downhill.
Okay, so you're summing up addiction.
Yeah, and not only that, you're subbing up, I think, there's a lot of, this is where it actually becomes more therapeutic, I think, and that you need to really start looking at the underlying reasons that you're self-sabotaging yourself. Right? Because
yeah, I mean, even after I take a pill or whatever it is, I didn't want it. You know what I mean? Like it wasn't fun, and I immediately start disliking myself.
Josh, let me ask you a question. Are you going to 12-step meetings in New York?
No, I've never done anything of that nature.
Okay.
I tried a therapist once, and I just didn't understand how talking would help anything.
So this is something Andrew and I talk about a lot because, you have all these commercials out there, right? You have the lap band. You have, in LA, we have Freeze the Fat, where it's like fat sculpting. And essentially what all these things are is it's a Band-Aid. It's like how many people do we know, Andrew, that have the lap band but put on weight after?
Right.
Because
well, excuse me. I think with Josh, Josh, you're talking about just the line that you said where you said, as soon as I get some money in the bank, then I just sort of self-destruct again. A lot of the reason that people use opiates normally is because they don't want to feel. There's something about feeling feelings that they want to cover up, and opiates are the perfect drug for that because it just makes you not care. And even if you still recognize the problem, your feeling about it is sort of absent because of the opiate. Right. So as soon as you start actually feeling something, even if it's a positive stress, like having money in the bank, right? I mean, that's a good thing, but it's also a positive stress because it now means you have opportunities to do things and make more choices. So you're going to have to come to terms with the fact that, if you want to get off of opiates, you're going to have to learn how to cope and how to feel.
And one of those ways that we talk about is through therapy, through 12 steps.
And I just don't think you can do that on your own.
Yeah.
I mean, even if you could just white knuckle it and get off of opiates for a while, what are you really going to do with all these feelings? Can you really identify them? Do you really know what's driving your underlying addiction? Is there maybe something else going on? Do you suffer from chronic depression? Do you have an anxiety disorder? What failures in your life or developmental delays have occurred because you've been using opiates for a period of time? How old are you now, Josh?
I'm sorry?
How old are you now?
28.
So 28. So how long have you been using for?
At this point, it's got to be, I mean, like I said, it's off and on, but at this point, it's like 5 years, something of that nature.
Right. So you're hitting a crucial stage in life developmentally. I mean, you've gotten, you're a young adult now, and you're supposed to have full identity formation. So you're supposed to, and I know that sounds sort of like psychobabble, but what it means basically is you're supposed to have a pretty good idea of who and what you are and what you're going to do and what your purpose is. And when you're taking opiates, it's really hard to make that happen.
Josh, let me ask you a question, Josh. Are you drinking too, or is it Suboxone?
No, I mean, I used to be a drinker, and I used to enjoy it. I never really had an issue with that, but the second I started taking opiates, I stopped drinking. I have no urge to do it. I'll even go meet friends at a bar, and I'll order a soda.
Right.
That's actually good, first of all, because, just as a warning out there, the number one way to overdose is opiates and alcohol. So,
sure.
You should definitely, if you are abusing opiates, don't drink.
And who gave you the Suboxone?
I'm sorry, say that one more time?
Who gave you your script for Suboxone?
Yeah, I started with the doctor, but I do not have insurance, and now that's a whole other
That's
problem I'm
expensive
having.
drug, yeah.
Because I buy it off the street now, but the same people that are dealing the opiates are dealing the Suboxone.
Wow.
Yeah,
That's...
and the danger is there is graduating to heroin because that's what we see quite often, and mostly by the time people get into treatment, they're mixing all three or doing some sort of combination by topping off. So
well, everyone lot of my friends that used to take pills with me went to heroin because OCs weren't around anymore.
Right. It's cheaper too. So
yeah. So my specific one is the Opanas, but no one else did that with me. Everyone else went to heroin.
By the way, so Josh, listen, I mean, the best advice that we could give for you tonight, first of all, is we do have a lot of connections in New York, okay, as far as therapists, as far as outpatient programs. So we would love to give you some help with that. But also try to get yourself to a 12-step meeting if possible.
Yeah, I'd go to an NA meeting. Just, if nothing else, just to network and meet with people. My whole thing with NA and AA at first is like, just, you don't have to buy it all. Just go there and hang out and meet some people, because one of the biggest problems with doing drugs and alcohol is that you just become so isolated. And if you just get into a community of people that have actually been working on the problems, the amount of resources that you'll discover from them as well will be quite impressive.
Better resources than having a drug dealer that gives you Suboxone.
Yeah, that gives you Suboxone.
and the drug.
I love that drug dealers are now giving out the cure.
The drug dealers are resourceful. So, Josh, would you stay on the line so we could get your info if you don't mind?
Sure.
And we'd love to be able to give you some help out there.
Yeah, well, we'll have someone of our treatment advisors give you a call and give you some local meetings there in New York, and then also maybe hook you up with some therapists.
And it's absolutely free, so don't worry about that.
Well, thank you so much.
And Josh, do us a favor too. If you could go to Facebook, just private message me so I can get to know who you are. So if you ever need anything, we could talk to you also.
I would, but I don't actually have Facebook.
That's okay. You could email us too. And just go to KLEANradio.com.
Yeah.
And just email. It's all private, Josh.
All right. Thank you.
Thank you.
Thanks for the call.
That's Josh from New York. You're listening to KLEAN Radio, and that was Josh from New York talking about. I mean, that's pretty amazing, Andrew. I mean, he's addicted to opiates. He's getting Suboxone, which is a.
Well, it's just, I think it's ironic that these drugs are leaking out. These maintenance drugs to keep people, stable, are leaking out into the drug dealers' hands again, and that shows you how much demand there is. There's not enough supply with so many addicts that they're actually taking the drugs that we use to detox people with. Just to try and stay stable.
But what's amazing too is that we constantly think, because we're in the addiction world, that everybody knows of the 12 steps or everybody knows of many different things. His first resource was to go and get Suboxone.
Right, from the doctor.
Not to go and get, to maybe a treatment center, maybe not to go to 12 steps. Mm-hmm. And that's pretty amazing
that's the limited sort of resources. Well, I take issue with the fact that so many doctors now are actually prescribing these drugs, and you used to have special privileges to engage in this, and now even with the limited sort of extra certificates that you have to get, we see so many doctors as just an extra revenue stream, opening up like little private detox centers in their office, and all they're really doing is providing a prescription again. And you pay your money, you get your prescriptions, same way you get hooked on the pills. And
it's this vicious cycle.
Yeah.
So if anybody out there that's listening, you are listening to KLEAN Radio, and you have any advice for Josh, give us a call. The number here is 800-222-5222. That's 800-222-5222.
Just one more thing on Josh, I think, which is my major point that I was trying to make to Josh when he was on the line there, is that, it's really what's going on that's driving this addiction. The fact that he's like chipping away at it and trying to like make it work and not make it work, and he's just experimenting with dose levels right. And, trying to stay sober, but then he gets too anxious or whatever. There's obviously a lot of underlying issues that he needs to deal with. And to do that, you got to get sober first.
That's the amazing point you just made, because I used to hear somebody in New York used to say that to me. He goes, you got to stop drinking to change.
Yeah, I mean, we can't, when someone comes into our treatment facility, it's impossible to diagnose what's going on besides the addiction until they've baselined, or basically until they've been sober for a period of time.
What does baselining mean? Because we use that term.
Yeah, baselining is when someone comes in, we basically take them off of everything we think we can, and then we detox them, and then we hopefully get them off of everything completely. Some people have medications for seizures and things like that we can't take them off of. But we take a look at what their behavior's like, what their mood's like, their affect, once they're off of all the medication. And then we can observe whether or not there might be other psychiatric diagnoses like mood disorders or thought disorders or depression or anxiety, things like that. And then we'll reintegrate medication as well as therapy if needed.
Okay, let's go to unknown. I always like unknowns. Welcome to Clean Radio, unknown.
Hi, my name's John, actually.
Okay, John.
Hey, John,
welcome to
how you
Clean
doing?
Radio.
Hey, guys. Thanks for doing what you're doing. It's really cool. I'm in California. You said if you have any advice for Josh, I'm someone who's been clean off of opiate addiction since 1998.
That's right.
You guys have made some great points for Josh that Josh needs to understand that his using of the drugs and his confusion as to why he's using drugs, the drugs are a symptom of something else.
Mm-hmm.
You talked earlier about is it a disease or not, and we could have that debate separately, but he's got something going on in his identity, the way he looks at himself, the way he experiences and relates to his emotions, and that's why he's using the drug. There is no prescription that's going to help that.
Yeah, I mean, the prescription will just deal with the detox, and
right.
And that can be a repetitive cycle as we're seeing with Josh. Clearly, though, as you point out, and I think I pointed out as well earlier, that the fact that he feels like he needs to take it when he's doing well, he gets money in the bank, shows you that he's got some sort of issue that's making him want to self-destruct. He's scared of his own success because it means taking on responsibilities and things that maybe cause a lot of anxiety, and he's not ready or prepared to deal with those things in his life. And he needs some assistance, I think, and everybody needs a friend and some help sometime.
That's not the drug dealer.
Yeah, that's not a drug dealer.
Absolutely.
Yeah.
I mean, honestly, I've heard a lot of things.
Yeah, my best friend's my drug dealer,
I've
right?
never heard of the drug dealer being the source for you getting off the drugs. That's really one of the first I've heard, Andrew.
Well, I don't think they are. They're just keeping them maintained.
Right. They're doing their...
Guys, that would be my really the point I'd like to make to people like Josh. You're not off drugs.
Yeah, you're not.
Right.
That's right. You're still on Suboxone. And then you're still getting the numbing effect. I mean, right down to 1 milligram. That lasts even half milligram if people are, really cutting them down. When we see people detox off that last milligram, it's as hard as just going cold turkey almost, because all those feelings come back for the first time.
Listen, John, can you hold on? Because I actually want to hear about how you got sober, but we have to run to a break, if you don't mind.
Sure.
Okay.
No problem.
Hold on a second. You're listening to Clean Radio. We have a great show going on tonight. We have a lot of callers lining up. Andrew, it's an amazing subject about...
Yeah, we're getting right into it, and there's a lot of important things to discuss, and I'd really like to get to all these calls.
So the discussion continues at Clean Radio.
Are you or someone you care about addicted to drugs or alcohol? Addiction ruins lives and destroys families. Bring an end to the pain and suffering by calling KLEAN Treatment Centers. KLEAN has helped people from around the world break free by not only treating the addiction, but the underlying causes and providing vital aftercare so people can get clean and stay clean with no gimmicks and no false promises. If you need immediate assistance or just have questions, call KLEAN Treatment Centers for guidance. A much better life awaits.
Welcome back to Clean Radio. We have a live conversation going on tonight about how do you get off drugs, how do you stay off drugs, and all that comes in the middle. And Andrew, what's great is that we're actually having dialogue about this, because for so long there wasn't dialogue.
Yeah, it's great to see that people are actually opening up and sharing their stories with us. And as addiction increases, we just got a stat today that for the 11th consecutive year, fatal drug overdoses in the U.S. have increased. So, I mean, this is a problem that is not going away.
And it's not like it's a small number to start with.
Yeah,
it's like in the millions, and it's going up in the millions.
Yeah,
and
it's a bad deal.
It's a very scary number. And we had a call before for Josh from New York, who's trying to get off drugs, trying to get off opiates, and he's getting help from his drug dealer, who's giving him Suboxone, which is a drug that's used to help people. Right. And we're asking people what advice. So
it's used for detox. Yeah.
That's used for detox. So we have John on the line. And John, how did you get sober?
Well, like everybody else, I went through a process that was long and painful. But I can tell you that in December of 1998, I gave up cigarettes, heroin, and crack the same day.
Oh, wow.
Mm.
And I did it, guys. I did it cold turkey on my sister's couch. I didn't sleep for 9 days, and it was painful. And I have, in addition to the many things that I've done to maintain staying clean and sober, that memory has helped me. I'm not a fan of drugs that make it easier for you to get off of drugs. I'm not a fan.
I have mixed feelings about that. One is that it's dangerous. to just go cold turkey. You know, a lot of people die from that. And so, you know, I do recommend that people see a doctor. And
with an exit strategy of when to get off those drugs.
Yeah, because, I mean, even from alcohol alone, just stopping drinking can kill you. So
as long as there's an exit strategy, Andrew, because that's a big factor. And, John, that's what we're saying is, you know, you do need sometimes to detox with certain meds. But to be on those same meds 2 years later could be a little dangerous, Andrew.
Yeah, I mean, absolutely. And there's, you know, some of these detox protocols are not good. And there's a lot of debates still going on at the national level about what are the best detox protocols for, you know, everything from alcohol and drugs. So it's something that's being improved upon all the time. Now, it's interesting that you see that negative reinforcement worked for you in terms of feeling, you know, remembering the experience of a really negative withdrawal. But I bet you could also think of a lot of other negative experiences while you were addicted that are reasons that you don't want to go back. So, right. So, you know, on that case, I'd rather err on the side of safety and caution for people out there that, you know, you don't have to put your child or whatever through a horrible detox to make sure they stay clean. And that was a belief for a long time that detox should be uncomfortable and really, you know, almost like punishment for the addict, so that they don't go back on. Studies have proven that overall that doesn't work statistically, and also that it's potentially dangerous
also
with
because
seizures and other problems.
That's something we talk about on the show. How do you punish somebody that sticks a needle in their arm?
Yeah, somebody
They're punishing themselves.
Yeah, somebody that's already that far down, you know.
Josh is in hell.
Yeah.
You can't
Guys, I don't see it as a punishment of myself, like I deserve something bad happen to me. I'm not aware of, like, correct me if I'm wrong, you guys probably know better than I do.
Probably not.
I'm aware of people dying from alcohol withdrawal, but I've never heard of anybody dying from an opiate withdrawal.
Oh, absolutely. Yeah, that's very much so.
That's true. Okay,
People have cardiac arrests all the time.
Yeah, I mean, we've sadly seen it.
And cocaine is cardiac arrest city as well. So
yeah.
And you know, John, it's great that you made it. If you know, and we're gonna get Josh's information. If you could stay on the line, I'd love to get your information. Maybe we could connect you and Josh. That would be really cool.
You know, one of the positive things about just going back to NA and AA that we were talking about is the idea also that we're just hearing now is that you get to see people when they first come in and get to see the misery they're in, and that reminds you of what the place you were at when you were at your lowest. And I think that can be just as powerful as your own experience.
One more thing I'd like to say really quick, if I have a minute.
Yeah, sure, go for it. I'm counting.
I'll tell you guys really quick. Something that happened to me back in '98 was I was actually in a dark alleyway in the middle of the night in a big city buying drugs, and I got stabbed. Oh. And at the time, my fiance, who's now my wife, was pregnant, and I remember basically bleeding to death in a hospital and thinking I'm not going to ever see my child be born. And it really caused a huge shift in my self-identity, how I connected to who I was. And in that moment, I think I said, you know, I'm going to become a parent to my child rather than be what I've seen myself as. I think our sense of identity, of who we are, Josh keeps going back and draining his bank account because when things get good, that doesn't fit his identity he's carrying around of who he is. And it's a lie he's telling. So,
well, that's something, John, to interrupt, I just wanted to say, you know, it's like people always say in the 12-step world, they always say, remember your last drink. And I'm always like, I want to remember the day before my last drink because that was the day that I decided.
The day of your last drink.
The day of my last drink because that was it. You know, it was that they talk about that incomprehensible demoralization. So, John, if you could stay on the line because I would love to connect you guys, okay?
Sure.
Thank you so much.
We're really backing up here with calls. Why don't we take another one?
But let's just give out the info quickly. Okay. If you just tuned in, you are listening to KLEAN Radio. The number here is 800-222-5222. That's 800-222-5222. We have a couple calls here. And Aaron, stay on the line because I actually want you to respond to this next call that we have because he's got different advice for Josh. John, welcome to KLEAN Radio.
Yeah, hi guys. How you doing?
Good. How are you?
I'm okay. I really don't have any advice for your former caller. I just wanted to tell you that I mean, if your life is not so happy, if you're in a period which is not so great, I don't think opioids are all that terrible.
Well, that's the advice. That was what I was referring to. Your suggestion of opiates.
You know, opiates.
I've never shot up. I've never.
You know, let me just stop you right there. Like, opiates are not prescribed ever for mood disorders. You know, if somebody's depressed or feels bad, blocking their feelings that way is not the way to go. There's antidepressants and anti-anxiety medications that are much more effective.
I don't do any of that. I'm just saying that opioids, you do some opioids and you have a couple drinks. I've done that for 15 years. And it's not
okay.
often on, and I would never recommend it, but I don't.
You just did.
Right, you're saying...
I'm just saying for me, it works a little bit, but I mean, you're right. I shouldn't call up on a program like this.
No.
Actually,
John,
I mean,
John,
I actually
please.
like to hear it, John.
Yeah.
I mean, and this is one of the problems I think that some people that don't have an addictive personality see as a moral failure with people that are easily trapped by addiction. People that can like jump in and jump out. They can drink a few drinks and maybe they can binge drink, and then they can not drink for 3-4 weeks and it's not a big deal. And then they're like, oh, why is that person so weak? They have one drink, and next thing you know, they can't stop drinking for 6-7 months until they get help.
Yeah, I don't do that.
Right.
I don't drink, and I do have an addictive personality. There's no doubt about it. No question.
Well, you're playing on a slippery slope. I mean, I don't really know you, obviously, and I don't really know your behavioral patterns, but it sounds like there's probably more to this than we're hearing.
I mean, that's a long time, John, to be mixing opiates and
booze.
booze.
Also, there's something called polyaddiction, so you could be switching from one thing to the next and thinking that you're, under control because you're only using, opiates one day and then you're drinking the next, and then maybe
right.
Then maybe you're gambling the other day, and
No, I'm not. I just wanted to say Suboxone. To me, when I found Suboxone, I found that to be a miracle drug.
Okay, John. John, you're a great call. I got to be honest with you, but I want you to realize this: non-addicts, non-alcoholics never go. When I found Suboxone, I found it to be a miracle drug. I mean, and I'm not saying normal people, but I'm just saying regular people.
Yeah, most people that aren't addicts or don't have a problem or are a developing problem actually don't like to take these medications at all. They make them feel out of control and uneasy, and they often won't finish the prescription.
The only reason I take it is because you don't have to suffer those miserable withdrawals.
Okay, so
but the fact that you're withdrawing shows clearly that you have a problem.
Absolutely.
Yeah. So what are we going to do? So John, maybe it was on purpose that you called in tonight. Right? What can we do to help you?
I'm not asking for help. I'm just calling to say that I think it's not always, so terrible. These drugs. I don't. I would never
John, you're advocating for a lifestyle of chronic drug use, which
I'm not. If I were happy, if my life were really happy and things were good, then you don't need drugs.
Yeah. Okay. So maybe like working more on like making your life happy and figuring out why it's unhappy might, instead of like trying to rationalize why you're using.
So how could we make you happy, John? What's
making you unhappy?
Yeah, that's a good question.
Why are you so miserable?
What makes me? I'm not miserable.
No, because you're using the drugs. But
they make me feel good.
Right. So what is making you feel bad that you need to use the drugs to make
you're just unhappy, your life is good, you're not in love, you don't have a girlfriend, and it's like those things. It's not the worst thing in the world.
No, but John, hear this out for a second. Most people, if they're not dating, don't take Suboxone. They go on a dating site or ask their friends.
They go to the gym.
Or they go to the gym or ask their friends. It's like you made the big hop, skip, and a jump from loneliness to Suboxone.
I'm just going to play Xbox and take Suboxone.
You cut the dating part out of the equation, usually, which is how people find the girl.
Yeah. It's hard to find a girlfriend when you're just sitting on the couch playing Xbox and taking Suboxone. So.
We're not accusing you of playing Xbox, though. John, so...
All I'm saying, guys, look, I don't want to go on.
Yeah.
It's okay. And I don't do it all the time. I swim every day. I try and swim a mile a day. That's exercise is salvation for me.
Mm-hmm. Right. I don't recommend, by the way, swimming and taking Suboxone.
And drinking.
Yeah. Opiates and swimming is very dangerous. More people actually die if they have a pool at their home than if they have a handgun.
I'm going to tell you what, John, and this is a challenge. We're going to call this the John KLEAN Radio Challenge. You ready, John?
Okay, I'm ready.
Okay, today's Sunday. Okay, so within the next 7 days, try not to use Suboxone or any mind-altering substances for 7 days.
And call us on Sunday and tell
us
how
next Sunday how you feel.
Are you guys on every Sunday?
Every Sunday night.
Every Sunday, 6 to 7.
Okay, you guys are cool. I appreciate that.
All right,
we'll
John.
call you next Sunday.
Okay, John.
Thank you.
very
Let's have
much.
fun with our clean
Appreciate
experiment here.
Yeah. That's the John Clean Challenge. Thanks a lot, John. If you just tuned in, you are listening to Clean Radio. That was a great call, but we want more calls, so give us a call at 800-222-5222. 800-222-5222. You got to love a guy like John because he's brutally honest, Andrew.
Well, I just like, to me it's so, and John, don't take this personally, I know you're still listening, but, just the roundabout cyclical arguments with, addicts or people that are just engaging in, chronic use of drugs, and how there's always a rationalization. There's always another path, you catch them on a point and, there's another point. And that's why it takes so long, sometimes for people to actually stop using, because there's so much denial and rationalization and convincing themselves that this is actually a good thing. And, it's because they don't want to let go, they don't want to let go of using, and they don't want to face the consequences, and they don't want to feel their feelings, and they don't want to get on with their lives. And, what's the point? I mean, are we all supposed to be just living like this stagnant state of like, is it like Soma, like 1984, where everybody would just take a happy pill and like nobody will actually feel anything or live a life anymore? Is that where we're getting? It might be.
And one of the reasons we're talking about this tonight is because we got a call from Josh in New York who's struggling with addiction. And I love that John called up to sort of make the point that, it's okay. It's okay to use, because it's just okay. Maybe that's as good as it gets, I think, is sort of what he was saying. Mm-hmm. And, I saw that movie. I remember that movie, As Good as It Gets?
Yeah.
And that was sort of the point of the movie. Maybe this is as good as it gets. You know what? I got to tell you, you're wrong. Because I'm sober about almost 15 years, and I got to tell you, it's pretty great.
Yeah.
I'm a guy that was scared of heights, but I've jumped out of a plane. I get to know you. And so my point is, it's an amazing world.
Right.
And the problem with addiction is we're so scared of life. We're so scared of living. That's what addiction sometimes is. And all the time we talk about, you can't scare an addict with death because they're not scared of it. You scare alcoholics and drug addicts by telling them
Like death is the easy part.
That's
it's
right.
Living that's
Tell
hard.
an alcoholic they're going to live a great life. That's scary.
Right.
And so let's go to Erin. We have Erin calling from Los Angeles. Welcome to Clean Radio, Erin.
Hi, thanks for having me on.
Thank you for calling.
I actually wanted to call for the guy named Josh who's on Suboxone. I've took every opiate known to man, and out of heroin, Suboxone, and methadone, heroin is the easiest by far, because those long-term opiates are just horrible. They drag. I didn't sleep for 30 nights. That's how bad methadone was. And but I have some really good natural ways that he can kick Suboxone that I've learned the hard way. And there's a couple things out there. The one that's legal here is called Kratom, and he can get it online. And Kratom can be addictive if you take it for too long, but he can wean himself off of Suboxone using that. He can just order it online. And there's another one called Ibogaine, which is not legal in the United States, but you can go down to like Rosarito, or you can go to
both
the Bahamas.
both the drugs you're talking about are hallucinogens.
Yes.
And you're right. Ibogaine it's legal in Canada and it's legal in Mexico. They've done a lot of clinical trials on it. For some reason, people take Ibogaine and you basically hallucinate like crazy for a day. And then it does tend to reduce cravings. But the irony is if you take ecstasy, it also reduces cravings for cocaine for a while. But that doesn't necessarily mean it stops you eventually from getting the cravings again. And what we've seen with Ibogaine is the long-term studies don't show that it has a absolute ability to stop cravings long-term.
Essentially, it's acid, right?
No, it comes from, I believe it comes from a bark of a tree in South America. But it's basically a hallucinogen, and there's ways that the brain can become overwhelmed in different ways, and so your craving mechanisms can change. And there's a lot of research going on to that. The Ibogaine issue is that nobody's been able to really isolate what it is within the Ibogaine that seems to be the causative factor in reducing cravings for opiates. And then when they have tried to isolate it, they found it doesn't really work. So a lot of it has to do with I'm talking about the chemical, the direct chemical. So if you remove the hallucinogenic experience, the active chemical that they thought was the one that was helping with the detox actually doesn't have an effect. So there's something
I didn't
about
hallucinate. at all when I did it. I just threw up, went to sleep, and woke up the next day and didn't have to be sick. I mean, it completely cured my detox. It was amazing. I'm telling you, it's a miracle.
And what are you doing now?
Where did you do Ibogaine?
I actually ordered it online from Amsterdam from this really nice lady. And the thing is, I did do it in an unsafe way because I found a provider online, and I just got lucky. This really great lady helped me out. She's done it before. She's been doing it for years. And she came to my house, and she watched over me all night. And I just threw up, fell asleep, and woke up the next day completely off all long-term opiates. And it was just awesome.
And you haven't done it since.
I'd love to know who that person is.
Yeah.
Maybe you can send us their email. I'd love to explore that some more.
I would love to. Her name's Beverly. I don't have her number offhand, but
don't worry about it.
Just
you could email us at KLEAN Radio, KLEANradio.com, and just email us. Because here's the thing, Aaron. We're not.
I'm actually all for this. You know, if there's if there's a way for people to detox in a safe way and a better way, and it has a better effect, I'm all for that. My experience in investigating Ibogaine, I looked at it pretty seriously for about a year, was that the longitudinal results were not that good. And that we had better effects with just traditional detox methods.
And Aaron, have you been off the opiates since?
Yes, but I do go to 12-step meetings. Okay. I have a sponsor. I work my steps. So, I mean, I don't
So that's
think
Aaron, that's the important part of what you're talking about. Because one of the things we were talking about before is we're not against certain things.
Yeah.
But we're against certain things if that's all you're doing.
Right. And we can do, and different people have different needs in terms of detox. Right. We can detox someone pretty much cold turkey in about 2.5 days safely with traditional medicine. So if somebody really wants to just get off the drugs, that's a choice you can make. The other thing is that some people aren't ready for that. So you have to take clients at the level of willingness to become sober. And sometimes it takes, a little longer and a longer detox process to get someone off of everything.
And Aaron, you were ready, right? You were ready to give up.
I mean, you went to extraordinary. Yeah, you went to extraordinary lengths to go ahead and detox.
Part of the problem is a lot of people look at Ibogaine and they look at a lot of these different forms of whether it's a lap band or anything. They look at it as, I don't have to put in the work. I could just get this and I'm cured. And you're the opposite. You were at your wit's end, and you said, I gotta detox to get help. You
said effectively for detox, and then went on to treatment, which is great.
You're in the vanguard of people that is actually doing it for the right reason.
Right. I mean, I have 3 other clients that used Ibogaine, and they all relapsed within 3 months. So,
But it's about the detox. I didn't do it to stay clean. I did it just to
right. What we're saying is you used it for the right reason. And
the thing I'd put out there is that while it is legal in Mexico if you believe in Mexican healthcare, and it is legal in Canada
and Amsterdam apparently,
and pretty much everything's regulated but sort of overlooked in Amsterdam. So my thing is that there's ways to do it in the United States that we know are proven, that they're very safe,
right,
and that don't have to take 3 or 4 months. So, if you're still looking for a quick way to detox, that's something that, we do at KLEAN, other providers do effectively, in safe ways that are legal in the United States. There's no reason to keep using illicit substances in the U.S. when we have perfectly good ways of detoxing people in the U.S. Now, that's not to say that we shouldn't keep looking at it and exploring it, but trust me, there's a lot of reasons that drug companies choose to look at things and not look at things, but there's a lot of new detox protocols that keep coming out all the time, and we're getting better and better at it. But right now, we can safely detox someone fairly comfortably in at least 5 to 7 days, worst case scenario.
And no offense to Mexico.
Yeah,
but,
off of methadone, you can detox someone in 5 to 7 days off of methadone without a rapid detox.
Depends on how much they're on. All depends on how much they're on.
Well, I was on 150 milligrams for 5 years.
Yeah, that's a lot. For me? That's an awful lot. Yeah.
Yeah.
But again, Aaron, you
that's
had
about
the willingness.
4 times the usual dose.
Aaron, again, you had the willingness to want to stop and to continue to stay stopped. And people that are seeking the Ibogaine or these quick fix.
Yeah, well, like I said, I'm happy for it. I'm glad it worked, Aaron. I'm not opposed to the fact that it worked for you.
Yeah, and please send us the info. We'd really love to find out about these people.
More,
Okay, I'll email you guys her number and I'll give you out some information. Okay.
Okay, great, Aaron. And if it's easier to go on Facebook, go to Facebook/KLEAN Radio. You could private message us and we will respond ASAP.
Well, thank you so much for having me on.
Yeah,
Thank you, Aaron.
Thank you for sharing your information.
Thanks. Bye-bye.
Bye-bye. If you just tuned in, you are listening to KLEAN Radio. That's KLEAN with a K. The number here is, I'm sorry for laughing. Aaron was a great call. And the number here is 800-222-5222. That's 800-222-5222. Reason I'm laughing, Andrew, is because obviously it worked for her, the Ibogaine. But to people out there listening, I would heavily suggest you don't go online, find an old lady in Amsterdam, and order a detox med from her. I mean, it's
sort of drug addict thinking.
Yeah, that's extreme drug addict thinking, and this is no offense to Erin. I mean, I
it
get
worked
it.
for her. Look, like I said, I've known professional people in the medical field that have gone down to Mexico and used Ibogaine.
Right.
And like I said, it detoxed them.
But it didn't.
But it didn't solve the problem.
And the reason I'm saying...
And Aaron recognizes that as well. And, Ibogaine isn't legal in the United States, so it's not regulated. We don't have a regulated dose. You're talking about sort of taking things into your own hands when it's completely unnecessary to do that.
It's extremely dangerous, okay? I mean, no offense to the Amsterdam...
I mean, just honestly, throwing up and then waking up the next day, you could, there's all sorts of horrible things you could have. You could aspirate, there's... And
it was we talked about that. I watched that special on Taboo or TLC, one of those shows about people go to India and they get like tortured and punished.
They make them overdrink water and all sorts of crazy stuff.
And I remember I saw this and I came to you and I was like, is this any good? And you looked at me like I was crazy, but the people out there that don't know much, they see these specials.
Look, it's like any disease, people that have chronic cancer that, some sort of terminal cancer, they go and they'll look for anything. They're desperate to live. And addicts have that same mentality often where they feel like they're about to die or they're going to die. And they're desperate to look for any sort of fix they can find. And a lot of them have had failed treatment experiences in the past for a variety of reasons. Maybe they weren't ready yet. Maybe the treatment facility they went to didn't match with their personality. Maybe they weren't ready to express what they needed to express, so treatment professionals could truly help them. There's a lot of reasons why treatment fails or succeeds. Right now we're just talking about detox. Detox, is something that we can detox people off of everything that's known safely. There's no need to go to some lady in Amsterdam. But go ahead.
Let's go to probably our last call of the night. Let's go to Liz in LA. Welcome to KLEAN Radio, Liz.
Hi, I cannot believe I got through to you. I've never heard your show before, and I just thought I would try it. For probably 12 years now, have been on Klonopin anywhere from 2 to 3 milligrams up to 15 milligrams a day. I now have to get it illegally, obviously, from India, because now you can get it on the website. And I have tried everything with psychiatrists trying to get me down to 5. I've gotten down to, the lowest I've gotten down to is a half milligram. And then
how long did you stay on a half milligram for?
That was for about a week.
Yeah.
And
see, the problem is you're addicted to benzodiazepine. And the class of benzodiazepines includes Valium, Xanax, Klonopin, all the same thing, basically. It's the same family of drugs. And Ambien actually is also a benzodiazepine. The difference is they generally have different half-lives, which means that the amount of time they stay in your system is either longer or shorter. So Valium, for example, has a very long half-life. So you take Valium, it stays in your system for about 20 days or so. Klonopin has a pretty long half-life. Ambien has a very short half-life and only stays in your system effectively for about 6 hours. And that's why they use it to trip you into sleep. And then you sleep, and then next day it's sort of out of your system. So you're cutting down on your dose of benzodiazepine, but it's still in your system to a level of comfortability even when you're at a low dose. And then as the half-life wears off and it wears out of your system, then you start feeling the withdrawal effects. So you really need to go through a full detox for benzodiazepines, which is a complex detox. And it's also, by the way, a very dangerous detox. It's probably the second most dangerous detox out there because a lot of people have seizures when they come off of benzodiazepines.
Done alone.
Yeah, and one seizure is one seizure too many. You can fall down, hit your head, die. So you can cause brain damage, frontal lobe damage. There's something called hot spots that can develop in your brain because of seizures. So this is something that you should be taking very, very seriously. And if you're ordering prescription benzodiazepines over the internet, let me tell you, they've been doing studies on stuff coming in from India and other countries, and the dose of the actual active medication in the pills is all over the place. There's like a 50% standard deviation of the amount of active substance in these pills that are coming in. So you're not getting a regulated dose of the benzodiazepine you're addicted to. So you really need to go in for a professional detox.
Liz, do you want to stop?
Yes.
Okay. Liz, I'm going to tell you what. You know, I don't know what sort of insurance you have. I don't know what's going on, but you know, we have an amazing.
I have insurance.
Okay, we have an amazing outpatient program, and we have an amazing inpatient program, Liz. I want to tell you something. We had an amazing family weekend this weekend, and the biggest compliment, Andrew, that we got from this family was saying, you know, I've been to other treatment centers and I've seen their family stuff. She goes, this is the first time I actually believed the people that work there wanted to be there. Right. You know, and they absolutely. So, Liz, I want you to stay on the line, okay?
Okay.
And I'm going to have somebody call you right after the show, if that's okay. And we're going to try to get you in as soon as possible.
We're actually full right now, but we can hopefully we'll have a bed.
We have a bed that's waiting for Liz if she wants it, and that's a promise Andrew and I make to you, Liz. Okay?
Thank you so much.
And no, Liz, thank you because. You know, there are people out there, the courage and the strength that it took for you to call in tonight and share what you're going through. You don't know how many people out there you're helping by making that call you made.
Thank you. Thank you.
Thank you, Liz.
Thank you.
So please stay on the line, Liz, okay?
Okay.
Okay. Wow, Andrew.
It's you know, I these are the kind of calls that always scare me the most is when people are sort of taking things into their own hands and they don't understand the fact that, you know, putting all these chemicals in your body can actually lead it to death. And, you know, we see these overdoses and people kind of overlook them. And half the time they don't realize that, you know, they think, oh, you know, the person's taking way too much. And sometimes it's that they're taking too little or that they just decided to stop. They were actually trying to do right by themselves. Like they relapse right out of rehab and they stop themselves because they feel too much shame to go back and say, hey, I relapsed. And then they end up dying and not overdosing, but also dying from withdrawal. And it's just something horrible. And I hate that our show's ending so quickly.
So
tonight,
listen, so if you're out there and you're going through anything, give us a call after the show. It's 888-601-6040. That's 888-601-6040. The message of the show tonight is there's hope, and also please don't order drugs online thinking they're safe.
Yeah, they're not.
Because they're not. And I'm not a professional, but I can honestly say they're not. And
not to mention it's illegal, and the FBI does show up at people's doors.
So please be safe. If you have any issues, give us a call, 888-601-6040. I want to thank everybody out there that's listening, everybody that participated in the show tonight. Misfortunes Radio is next. The discussion continues at KLEANRadio.com. Thank you.
Are you or someone you care about addicted to drugs or alcohol? Addiction ruins lives and destroys families. Bring an end to the pain and suffering by calling KLEAN Treatment Centers. KLEAN has helped people from around the world break free by not only treating the addiction, but the underlying causes and providing vital aftercare so people can get clean and stay clean with no gimmicks and no false promises. If you need immediate assistance or just have questions, call KLEAN Treatment Centers for guidance. A much better life awaits.